Good morning. Welcome to the Maryland Lead Poisoning Prevention Commission. As we open, if we could just do a roster of who is attending that is on the commission, please, Wendy, if you could do that, I would appreciate it.
Yep, I see all them. I see Adam Skolnick, Anna Davis, Barbara Moore, and who else? Jacob Benzikin. Mangela Paul.
Yep, we have Paul Rogers.
Paul Rogers.
Susan Kleinhammer. Look at all these wonderful, beautiful people identifying themselves.
And of course, Ruth Ann Norton. And Paula Montgomery. I think those are.
Are you Paula Montgomery?
Veltri, yeah.
Paula Veltri. Yeah, you have been for how many years?
A little while.
A little while. Okay, there you go. All right.
All right. I think
We're
that's
back to
about it.
Veltri. Oh, I see. I got it now. Okay.
Did I miss any commissioners? If I did, go ahead and introduce yourself. But I think I got everybody.
And Susan has her hand up.
No, just to let you know I was present.
Okay. Yeah, I got you.
Did we hear from the FDA about today? So we might have to move again on them. Okay. So we'll keep pushing on the FDA there. But they're definitely, if we could move to the approval of minutes, if you would put the minutes up, please. And we want to welcome members of the public who are here as well. If we would put the minutes up, and if all of the members of the commission have had a time to look at the minutes. We still, Tyler, I might need a little help here. We still don't have word from the legislature on replacements for the two legislators.
Gotcha.
Really need to resolve that
Sure.
in present. So I just ask again, I know I've spoken with Regina Boyce from Baltimore, who's on the Environment Transportation Committee. And also Robin Lewis, who I don't know if she's still on Health Government. I think she is.
I think so.
But we need to get replacements on both sides of the aisle there. No, the legislature's a little busy, but I do anticipate next year we'll have probably lead legislation. It would be great to have their
Yeah.
advice.
You would send out letters to the speaker and president,
I
right?
had meetings with the speaker and president, but I will,
Don't know.
we should send a formal letter.
Sure.
Let's do that together. But anyhow, any other notations on the minutes, please? Okay. All right. And if we don't have any, can we have a motion, please? And I noticed that we do have Cliff Mitchell absent currently, I guess. Is he absent for today?
Yeah, I don't see him on there.
And I think, is Theodore also absent today?
Yeah, I don't see him either. And I hadn't heard anything back from them in email. So
Okay.
I don't know if they're coming a little late or,
Okay.
but they're not currently in.
Okay, great. So can I get a motion to adopt the minutes, please?
I propose to adopt the minutes.
Okay, can I get a second?
I second it.
Thank you, Paul. Thank you, Susan. All in
Okay.
favor, say aye.
Aye.
Or raise your hand on the thing, however you wish. Do a dance. All opposed, you have to do a bad dance like Elaine from Seinfeld. Okay, none there. Let's move on. Okay, we are still trying to get the FDA to come in to talk about the efforts that they are making on the lead in food issues around not only the applesauce issue and the cinnamon, but in general, how we are looking at consumer products that fall under the food products that fall under the FDA. Wendy and I will continue to work to try to get them here. I think it would be really important that we look at that. But we will move to the gentleman I last saw in Providence, Rhode Island, representing very well the Maryland Department of the Environment on compliance and enforcement measures, Fred Banks.
Good morning.
Morning.
You guys hear me okay?
How about we went to a state that just adopted the Maryland law?
That's all right. That's all
Yeah,
right.
20 years later.
Wow. Yeah. Crazy.
There you go. But Fred, they did put on a really good summit, and it did, something I do want to talk about is I think as part of they've now moved Healthy Homes Month to April, so that just did a whammy on us. But maybe in October, MDE and the commission ought to sponsor a lead summit similar to what Rhode Island did. I thought it was really good. It was really well attended. They had a lot on tenants' rights, a lot on property owner rights, and also sort of resources. So before you get started, I just wanted to say thank you and Chris for going to the summit. As you know, GHHI has an office in Rhode Island, so really appreciate that you guys went up there. So tell us all about where we are on compliance and enforcement measures here, sir.
Okay. I will share my screen so you guys can see what I'm presenting on. So for the quarters of 1 and 2 for 2023, accreditations, as you can see at the top here, we had a total of 428 for the 2 quarters of new accreditations and 337 renewals. And so this is really indicative of LRCA and the speed at which hopeful inspectors can go online and register for courses and take the exam. So we're really happy with the way LRCA is helping be more efficient in producing reports and helping the general public get their accreditations updated. We also have a number of accreditations in effect as of 12/31 of 2023, 1972, and the total number of dwellings that registered. These are new registrations, 5,547.
So those are all new property addresses.
Yes. Well, not necessarily, new to the registration system. So they,
Well, that's what I mean, right? So they've either converted from ownership to rental, or they are just coming clean for the first time, I guess, or something, right?
Yep, correct.
Okay.
As far as environmental investigations, these are all environmental investigations as a result of a referral for a poison child, a total of 248 for the 2 quarters. So we're on pace to probably get to about 650 based on the fact that starting in January, we're doing the 3.5s. So that'll increase that number a little bit. And as far as inspections and audits, a total of 1,684. I can't say enough about the inspectors. They've been really pushing hard and trying to keep their heads above water, finding all types of unique.
Where is the 1680?
Oh, that goes. I added up the 2 quarters. So if you see.
Oh, got it. Okay, thank you. Okay. So.
Finding. I'm sorry. Go ahead. What's your question?
No. Go ahead and finish it first, please.
Just finding all types of unique and challenging lead hazards around the homes, getting to family members, that children spend time at, and really just sort of digging into and sort of capturing the spirit of what it means to be an inspector, sort of a lead detective, if you will, and just not really giving up until they find a source. So I really want to commend our team for really being and over enthusiastic about really getting into the heart of what the hazards are in these homes. They're doing a great job.
Fred, how many inspectors does the state have? Do you have?
I want to say 18, and I think 11 of them are risk assessors.
Okay.
Yeah. So the risk assessors are our inspectors that can actually do the environmental investigations for the poison children. And the remaining.
Are they full-time on the lead program or do they do other things?
Full-time with lead.
Okay, great.
As far as the breakdown certificates, let's see, 14,000 full risk reductions, total of 1,600 lead-free certificates and 3,400 units, and modified risk reductions are 63. And once again, this goes back to this public-facing lurker site that allows inspectors to create these certificates and allows us to be more diligent on auditing how certificates are created and following up with oversight on the regulated public. So Lurker has been working out well for us so far.
So forgive my stupidity, but if I look at lead-free certificates and I see FY 24 total and it says 1611 over 3483, what does the first number mean? What's the second number mean?
So the number of certificates that were issued were 1611 and the number of units. So this unit is a sort of our measurement of a place that needs to be regulated, and that's 3,400 units. So one certificate can sometimes cover more than one unit.
Mm-hmm.
That makes sense.
Great, thank you.
All right. So
Can
By
I
the way,
ask
Fred,
another,
I'm sorry
I'm going to ask another question. Sorry if I may.
Okay.
You,
Okay.
the chair here. I see a drop, but it's within the same year. Is it possible that you could provide to this body a comparative of year to year? Like where were we last year? Where are we this year? A further year out from all of the COVID disasters of stuff. But are we up or down on a year to year basis would be what I would be very interested in. Are we doing better, getting more, it looks like we got more units, right? And et cetera. But wanting to see our year to year performance would be, I think, a really good way for the public to see what we're doing.
yeah, I can definitely pull that. I will just from I can tell you that we're a lot faster with the system that we're working with. So we've actually decreased the time to produce certificates from several days to 2 to 3 days. So I'll definitely I can have that for you.
And the other thing is, are we finding that do we have any way of knowing if we are declining on registrations due to vacancy, like vacant units? There's no way to maybe know that, right? Unless you did a cross-check with the city.
So the great thing, so we have sort of 3 systems that we're working in, and the online rental registry has an audit report where we can see the number of registrations that don't have certificates and how many are removed annually. So we can look and see, for the certificates that, and this is, it's good and bad. It's good in the fact that if a 1978 property goes to be lead free, it comes off our books as far as a $30 registration fee, but now it's a safer home. So we do lose some revenue, but it sort of pushes us towards our goal of having a lead free, safe home for a family. So it's both good and bad, but it is definitely related to our mission and what we are trying to accomplish. So, but yeah, we can audit those, and our inspectors and our risk assessors focus on these compliance issues all the time, where they pull reports and look at the number of properties that are removed and why they're removed, whether they got certificates or not.
Okay, and Jacob, we have your hand up.
Yeah, hi. Thanks so much for this presentation.
And-
I just
and-
have a
Yeah,
I just
and
have
thank you, Fred, for letting us interrupt you as we go. So appreciate it.
It's no problem at all.
Thanks,
It's
Fred.
it's family discussion. All right, go ahead.
You brought up a good point in terms of loss of revenue for the $30 a year, but a safer home. What if any programs are available for landlords who are seeking to go from lead safe to lead free. So a lot of times, from my experience as a property manager, I think that there is a desire from investors and from owners to go to lead free, but the cost is just onerous. Are there resources available to help get them over that hump? And if so, I guess maybe you could talk about it, or if not for this discussion, maybe I can reach out to you privately.
So I did invite we ran into two inspectors with HUD earlier this week that wanted to partner with us on something similar, where they're trying to make sure that their HUD properties are in compliance with us. So they do have programs where if it is a HUD home and they're trying to get it up to compliance or to get it to be lead free, that they will help them with that. The other thing I think might be DCHD. That might be a Jack Daniels question. I'm sure they have programs for renovations and repair for homes to become lead free. So those are the two that I'm aware of, but I'll do some research to find out.
Well, Fred, I don't know what they do actually have in that. I don't think Ted is here, but Cliff, would the children's health insurance dollars help an owner go from lead safe to lead free?
I don't think, is he on?
Yeah, Cliff Mitchell's on. I just don't know if he's hearing us.
I am hearing you,
Okay.
Ruth Ann. So the question is, would it pay for your, and I assume you're talking about program 1, right?
Yeah, I mean, is there any flexibility within that program? If you have a Jacob Benziquin and he has a unit and he's like, I don't want to just be lead safe. I've got kids in this unit. I want to take it to lead free. I'm not
So
saying.
the answer, yeah, right. The reason is I've specifically addressed this with Medicaid and particularly with Jack Daniels. The provision of the state plan amendment, the way it's structured, is that it pays for lead safe, not for lead free. So we would have to amend the state plan and get explicit permission from CMS. That's not in the cards at this point.
I have something.
It's not on the agenda at this
You
point.
gotta put your hand up.
Yeah. Hi, Jacob. Check with community block grant programs. Within the state of Maryland, there are certain counties that I can send you, and I can send it to all the commission, the contacts for the community block grant programs. And I know that they're doing complete removal, abatement of lead-based paint, in particular the friction sites, the windows, doors, anything that it presents a friction area, they're doing complete abatement. So, and because they work with other partners within their jurisdictions, they can pull from different pots of money to do that. So I can definitely send you all the contacts for those grant programs.
Yeah, and before, Adam, I see your hand up, but before you do that, let me just say, and Wes Stewart's on the phone, so he can just tackle me if I'm completely wrong. But I believe under both our congressional funds and our ARPA funds, we could help to fund that in Baltimore City. I don't believe the city's lead hazard control grant will allow for that. But it does say to me, to Adam and Jacob, that this is something where, there are cities like Cleveland, and Milwaukee is now trying to do it. There are cities and states that have built these over 120 some $1 million lead funds. And Baltimore ought to be replicating this. I've tried to get the mayor and others behind this, but it is something that I think if we had the support of owners and the support of government, we might be able to build a fund that would not only do abatement work, but would be flexible to allow this. And if you look up the Cleveland Lead Fund, Cleveland Clinic for example, put $52 million into that. In Lancaster, the hospital there put 50 million. And I think we ought to work together to try to not only convene the hospitals, but convene philanthropy and build a fund that fills the gap that doesn't otherwise exist, or that we don't have funds to do. But Jacob, I will have Wes reach out to you. And thank you for that. But I'll have Wes reach out to you. And if you've got units in the city, we may be able to help with that. Adam.
I just had a question for Fred on what the two numbers, like your question before on the disposition of significant violations are. What are the two?
Yeah, I agree with you. And what does it mean? Yeah.
So I'll be honest with you. When I read the definition to the right, I think all of our violations are significant, but a specific language that speaks to whether it's a poison child on the property and how we define a poison child as a child that has a 10 or above.
What?
And if
It's 3.
well, I know it's 3.5, but this is just how it was sort of described in the definition. And so that's why I put the number before that. So the 224 and the 132 are all of the violations, and the 25 and the 27 are the violations under this definition that's to the far right there. So I, personally, the way I want to redefine this is that all of our violations are significant. I'll break this out a little more in the next report so that you can actually see what the violations are for each category and how many violations we have for each category.
Yeah, Fred, I don't know if it was a misstatement, but a mistake, or it was what the definition is. I'm not, so I'll give you a chance to clarify that. But any definition at this point of priority action, to be consistent with everything else in the state that we are doing, should be 3.5 or above. Obviously, if you got a kid with a 97, we're going to go there first, right? But just a question, is it currently being looked at by your Chris's office or others at 10 and above, or 3.5 and above?
No, so what, and I wasn't saying that sort of qualitatively, but how it's defined, how we pull reports is listed as, so we have 3.5 to 4.9s, and those are pulled out separately, then the 5 to 9s. And then anything above 9 is classified as a poison child, but that's just the way it's classified in the system.
Yeah, let me urge the state to just, with the Department of Health, just review that language. I think it's important, and I'll just, if I may, just urge you to take a look at that.
I got you. Okay. But yeah, so just looking at the number of violations, there were a total of 224 violations, with 25 classified as significant based on this definition to the right, and then 132 for Q2, with 27 being significant violations. But like I said, the total 356 were violations that I think everyone in this office considers significant when it comes to a child that has any lead level above 3.5. So
yeah, I just want to, I'm sorry, I just want to make, so the 356 total are violations, and they're all lead violations, or are they other type of housing violations?
These are all lead violations.
Okay, cool. Thank you.
And Fred, if I read this right, you've got 356, and you go down and say 286 of them have been resolved. So that means 97 are still outstanding.
Right.
Yeah, but it's not fluid. Do you understand what I'm saying? It means within that quarter, that's how many were resolved. So within one quarter, we identified this.
Pretty static.
Yes,
Okay.
exactly.
Oh, got it. But at the end of the quarter, 97
Yes.
still are there.
Right.
First of all, I think that's we want zero outstanding always, but that's a really good movement within a quarter to see that, or 2 quarters, 286. And so commendation on the work being done there. As you do this report in the future, right, it'd be great if to know a little bit about that triage and be very interested to know if it's, we can do it. Like, what is the highest levels that you're seeing? And are we doing any enforcement when before there's a poisoned child based on failure to respond to notices of defect? When we turn that corner and we are just on top of the failure to respond to notice of defects before somebody gets poisoned, that's going to be a good mark of success and value in the program, right?
Yeah. Well, every enforcement action that we bring doesn't necessarily mean that there is a child who was affected at that property. So I think we're making progress on that front, but maybe we can work together between now and the next.
Able to tell that story would be a good one, right?
Yeah, maybe we can talk about what this chart, maybe improvements we can make so that, yeah, the information is a little bit easier to understand, but what else we need.
Or, and I'm sure we're missing some too. But anyhow, sorry, Fred, keep going.
That's right. All right. All right.
I urge everybody to put your hand up, ask Fred a question, because
That's right. That's right. That's right.
Such a good guy.
All right, and I will say that, like Tyler said, the large majority of our enforcement actions are compliance to make sure people are doing what they say they're supposed to do according to the lead law that don't involve poison children. So our inspectors that do compliance do a great job of once they identify a property that's out of compliance to verify that with Dr. Boss's office to make sure there's no poison children or even a child at risk on that property.
Thank you,
All right,
okay, question from Susan, sorry.
Sorry about that. Fred, thank you. I wondered, because MDE does enforcement actions everywhere but the city, right? Is that correct?
Not necessarily.
Okay, so I guess what I was wondering is this reflective of the city also, these numbers?
Yes, so we do compliance actions in the city, and we were doing some environmental investigations in the city as of probably about 2 weeks ago.
Okay, thank you.
But yeah.
Okay. Thank you.
Okay.
But,
All right.
but then just to qualify that, we don't add in the city's enforcement actions to our numbers that you have here.
Okay, that's what because I thought the city kind of self-regulated for lead poison cases, so I wasn't sure if that was inclusive. Thank you for that, Kevin.
Yeah.
Kevin now.
All right,
All right.
and
So,
Tyler, we appreciate you too.
Thank you.
All right. So for enforcement actions, these are compliance assistance, and these are what we like to call actions that don't require any enforcement. This is us helping the regulated public meet the demands of what we're asking them to do to manage the rental property. So we had 91 in quarters 1 and 2. Administrative corrective orders were 89, and these were administrative complaint orders and penalties, and then a total of 589 other administrative penalties and enforcement actions. And as far as penalties,
Number of forms we've done.
I'm sorry.
Sorry, Fred. I was just
sorry.
explaining to Ruth Ann that the
We were
81.
making a bet on the Duke Carolina game, but yeah, right.
Okay, all right.
Yeah. She was explaining
So-
the administrative corrective orders.
Yeah, that's, I think that's an important number for everybody because that is the actual number of cases that we have referred to the Attorney General's office. And understand that each one of those cases could involve multiple violations for a property owner. So I think 81 is a significant number.
89.
And 89?
Yeah, 89.
Yeah, 89. Sorry about that. 89. Yeah, not
So
81.
for clarity and for the public, that means that an owner could be taken through administrative corrective actions and all of their units that we are able to identify
Right.
would then be, at its best enforcement, would then have to have uniform compliance.
Right. They're global. Any settlement is a global settlement.
And is it to a lead safe standard? Is it to a
Well, it
lead free
depends.
standard?
It depends. If they agree to meet a higher standard, like a lead-free standard, there's different negotiations that.
What
that
they
go-
agree to is different than what the order should be, right?
The order basically just states what they're in violation of. And then when we talk about negotiating terms of settling, and this isn't just property owners, this is, we can't forget Kevin Stanley, the division chief for accreditation and oversight. This is also violations of our accreditation and oversight for work practices by lead paint service providers. So anyway, this is just cases that basically were referred to the Attorney General's office that can, morph into, a very huge case. So they're significant.
And I'd just like to add to what Paul is saying. I think one of the things that not so much enjoying, but am satisfied with is that we've been able to take some really bad actors out of the game where they can't do lead work anymore. And so that's one of the things we were looking at is identifying sort of our 10 most wanted list of bad contractors, bad lead abatement workers that continually show up on our radar and making sure that they can't work in this field anymore. And so working with Chris and Marjorie in the OAG's office to make sure that we can not just, even suspend some inspectors that are doing bad work that we know are continually putting families at risk, to suspend them. But more importantly, if they're continually breaking the law, that they're banned from doing lead work anymore. So the
Fred,
last,
yeah,
yep.
sorry. I know you're getting to the last piece of this, but I have a question around, to go back a bit. When you go in and you send your inspectors in, and I know you're looking for violations of the lead law, my question is, are there other basic health and safety issues that your folks are trained to look for, even if it's visual, in order to either make a referral or take an action? And here's what I'm really thinking about, right? I don't know if anybody read about the tragic fire in Highlandtown the other day, where there were not working smoke detectors in the home, right? A lot of homes that you're likely to go into, right? There might be some very simple things that MDE could, and I would say should do, while your people are on site, and that is a basic health check that says, are there working smoke detectors and carbon monoxide detectors, right? The department itself has really been pretty clear on the understanding of the health impacts, obviously, of carbon monoxide as it does more and more work on climate, but we all know the impacts of that, right? But is this something that you all look at for, and that doesn't make us better. I'm not saying it for this reason, but my team, when they go in to do an assessment, if there's no working smoke detector, no working carbon monoxide detector, our team is supposed to be putting that in and making sure the family has it or testing it, because I don't think any of us want to leave a house and where there's something such low hanging fruit where we could do that. And then the second question is, do you make referrals for other potential health housing code issues that walking out of there as good professional human beings, we know there should be somebody else coming in?
So to answer your question, yes, but in a different way. So we train our inspectors to focus on the child, and so whenever we go into a property and there's a child under 6 on that property, or children or minors, we look at the things that affect their behavior or to identify their behaviors. And when we're not trained to look at certain things, we do have them document the behaviors that they see. So they might notice that a child has pica, but you won't see the word pica in their language. Still just make note to the behaviors that may reflect that the child has that condition, and be very observant about the behaviors of the family around that child and the things that might affect that child's safety, and then pass that information on to Dr. Boss, who passes on to the case manager for that county that may come in and do some of the things that you mentioned, Ruth Ann. So we try to focus on the issues and items that might affect that child directly,
That should be
and
helpful.
get
Yeah,
that
but I mean,
information.
this is a pretty clear
The health department.
empirical health and safety that I actually think, like as a public person, right? We try to operate GHHI as a public entity, right, as well, even though we're, I guess, quasi not or whatever. But I just think what a good service that would be for the community if we just ask the question or press the button and say, is there a working smoke alarm here? And if they have gas appliances and you see them, is there a working carbon monoxide detector? And if the department wants, I will work with the department to get you the supplies that you could leave there. But I think we've got to think that way a little bit. We'll go offline on this, not trying to
Yeah.
take you off your lead stuff, but none of us can live in a vacuum. And I'm sure whether it's a rental property, and I guess that's mainly what you go into or not, that's helping the owner too. Nobody wants to be the owner who didn't have a smoke alarm and kids die. Families, people die. So look, we all got to help each other. This one's simple. I won't belabor the point, but maybe we can talk about it.
I just have something to add. Cliff, I'm going to throw you under the bus. Sorry.
But it's an EV. Cliff, it's an EV.
Yeah, I'm wondering.
He's not even on.
Oh,
Oh,
he's
no,
not?
he's on. There he is. Okay.
I'm thinking this is something that the case managers do when they go in and do an assessment of the property. They're not just looking at, I may be wrong, but I thought that was part of their protocol. I'm pretty sure it is.
The feedback I get from the case managers that go into the home, whether it be city or any of the counties, they do go into nitty gritty stuff about what the child is doing, if there's pike, if what they witnessed for the interaction, and they'll communicate that.
Yeah, but Ruth Ann's talking about other safety measures.
Everything, no, like everything. Like,
Yeah.
they're using gas heaters. They
Yeah,
don't,
yeah,
they're using the stove, and
Yes.
Yeah,
all of
we're all trying to do that. Okay. So you collected $323,000 toward the public good, for violators. Tyler, I don't know if it's on the agenda, but what is the status of the fee, consideration in the
Sure.
Senate or the House?
So,
And if I'm going out of order, Wendy, I apologize.
so the House Bill 245 passed second reader yesterday, and the fee is still included. So,
Okay, and it passed the Senate or the House?
the House.
House.
Well, it will be third reader today, so it passed the House
Okay.
today.
All right. And what's the number again?
House Bill 245.
245. Okay. Thank you. Barbara, did I see you come on camera for a
Look
reason?
at her. She's front and center.
Okay, great.
Where's your grandbaby,
Fred, thank
Grandmom?
you. Appreciate you very much. 3 cheers for Fred Banks, but it does look like you're up next again, Fred.
All right. Let me see if I can share this again.
So this is the fiscal year 22 report, right?
Yep. Yeah.
And,
Well, great.
I'm going to ask a question. What is your landing goal for fiscal year 23?
May 1st.
Ooh,
Okay,
heard it here, folks.
all right.
Yeah,
let's-
Dr. Boss just kicked me under the table. I'm telling you guys now. But they've been, so just to give you guys a little
Thank you,
background,
Dr. Boss, for the May
Yes.
1. Let's go.
Yes.
Uh-huh.
we transitioned from Stellar to Helps, which is the new child-led registry system that we're using. And it was a huge transition back in July, August of last year. And so it was a lot of figuring out, new training and getting everybody on the right page and just getting it to work right. And so the team's been doing a great job of working with our IT department to get that up and running. So we're still hammering through some obstacles, but we're positive that we're moving in the right direction. So the one good thing I will let you know is that we are working with the county health departments to get them on helps as a new system that we're using. And so they've been able, we got 2 counties on, and so we're trying to merge people in slowly but surely. So they have access to view what we're doing with referrals for kids that have a 3.5 and above, and they can run reports on their counties as well. So we're trying to increase communication between MDE and the county regarding boys and children. So
All right. Do you,
got a question already?
yeah,
All right.
Well, then will the counties be able to see like the actual environmental investigation report as well and the notes?
So that's phase 2. Right now they can see the lead levels for the children, all the demographics for the children. They can actually upload case notes on there as well. We are taking that information and putting it to our inspector database. Now we just have to go the other way and put the inspector information into help. So hopefully in the next 2 to 3 weeks, we'll have that done. We've been running some tests. And once we get that up and running, I think that they'll be able to see when the inspection date's done, what the source was of the lead hazard, and all types of information about the environmental investigation. So that's our goal this morning.
That would be great. Thank you.
Yeah, yeah. All right. So this is calendar year
You wanna-
2022.
yeah, okay, great.
Can you put it in presentation mode?
Yes, ma'am. Yes,
Yeah,
sir.
that's what I was gonna say, but then thank you.
Is that better?
No,
Not yet.
Go from the beginning.
How's that look? Are you guys seeing this yet?
It's not, oh, is it just not updating on the presentation yet?
Oh, let me do this.
And then just go from the beginning.
there you go. Oh,
What happened to Dr. Branch at Baltimore County?
I have no
He
idea.
left left abruptly.
He left.
Yeah, like really abruptly. I just wanted to make
Try to
sure.
pull it up, Fred.
Give me one more shot, Wendy.
Okay.
That is a red panda for all who don't.
That's my spirit animal for you guys. I wanted to know that. That's my
Yeah.
crazy.
I like it.
And Adam is making a good request. If you could send this out to the commission post this meeting. When is the formal public release date?
So I will need to go through approval still. And so hopefully by the end of the month.
Okay. All right. So are you allowed to release it to us in draft form?
Typically, no.
Okay. Adam, we're working on it, but they're saying end of the month. Okay.
Got it. Thanks.
Okay.
All right, Wendy, I'm gonna need your help. So I think I just sent it to you maybe about 20 minutes ago.
I got
Yeah.
it. Let's
Okay.
see. I'm gonna give me 1 second to pull. Let's see. Present. This one down. I think this is the share. All right, let me know if you can see it in the presentation view.
Not yet.
All right. Well, let's just, if we can just go slide to slide and move, let's just go ahead and.
Oh, now we lost it.
Yeah, let me pull it back up. I think I know why. Entire screen. We're gonna do that one. See if this one works. Beginning.
Yes.
There we go.
Okay.
There you go. All right, next slide, please, Wendy.
Why is it not? There we go. No, that's not it either. Okay, there we go.
There we
Yep.
go.
So this is a summary table. You can see the number of tests. We had 101,000 children that were tested in 2022. The data that we have is 95,471 is 100% of the children that were 0 to 72 months. The age breakdown, the majority, of course, is 34% were 36% were 1 year of age, and then 2 years of age was 34% were our two largest populations. Males were 51%, and females were 48% of the population. We still had a little under 100 that were undetermined, and if you look below there, you can see the blood lead levels. Shamola did a great job of pulling out the 3.5 to 4.9 in 2022, even though we weren't dealing with that population yet, because we did pull some preliminary data in 2022 to see what the impact was going to be on our program prior to doing some enforcement for that group. So you see the large.
Yeah, go ahead. Cliff has a question. I will follow that. Go ahead, Cliff.
Yeah, thank you. And Fred, just a terrific job by Shamola, Dr. Boss, Victoria, you guys, the whole team. I got a question actually related to this. Our Medicaid folks just wanted me to put in a plug for whether we could have a conversation with you with them about Hilltop data question, because they just wanted an update. So I just wanted you to be aware of that fact.
Yeah.
Yep. And then the second thing is partly related to that is I'm starting with our team an evaluation of our home visiting program, both for lead and for asthma, because it's the 5-year mark. We just passed 5 years of operation from 2018 to 2023, and I'll be looking at outcomes associated with both lead and asthma home visiting. So you and I and Shamola and our team and Medicaid, the Hilltop folks, et cetera, will want to meet to talk about that, because it's obviously something that we've all been involved in. So I just wanted to put that on your radar as well.
Yep, we got it.
All right. Thank you, Madam Chair.
Thank you, Fred, actually, right?
I've got a quick question. I've got a quick question for Cliff, actually. Have we tracked any of the data from when there's an EBL with a capillary and a follow-up with a venous stick?
Oh yeah, no, that actually MDE looks at that fairly closely, as do we, in the sense of the kids that are in home visiting. And there's a lot of discussion about that on a regular basis. So just to be clear for everybody's benefit, the capillary tests are easier to do. They have a higher success rate of getting tested, but they are also somewhat more prone to false positives, because it's relatively easy to, if you don't prepare the skin well ahead of time, to pick up contamination from the skin that's not part of the actual blood lead, and have that show, if you've got lead dust on the skin, have that picked up by the capillary. And especially at low levels, that means that you're prone to possible false positives. Our preference, MDE's preference, the preference that we've told physicians over and over again, is if you have an elevated capillary test, you need to confirm that, and confirmation is preferred with a venous test. However, some providers continue to try to do confirmations with a second capillary when they don't think that they can get a venous test. And if you've got two elevated capillary tests close in time that look as though they are similar and not highly discordant, those have been accepted as a confirmatory, that second test has been accepted as a confirmatory test.
Yeah, that makes sense. Thank you.
Yep. Fred, feel free to correct me if I misspoke
No,
in any way.
I couldn't have said it better myself. Thank you. All right,
Thank you, Fred.
all right, next slide. This is our 0 to 6 by jurisdiction, and these are the 5 and aboves. Garrett County had a 0, which was great. Kent County had 1 case, and we had some low numbers on some of our Eastern Shore counties, but there were some city and county jurisdictions that raised red flags for us, and so we've been busy trying to do some outreach in some of those areas as well. So, next slide. So this is our 10 and aboves. For the number of tests is the orange bars, and then the number of children that tested 10 and above is the blue line. And you can see that the 10 and above went down from 2021 to 2022, which is great. Also, the number of tests went down. So we want to try to get those testing numbers down, up, and the number of 10 and aboves to continue to go down. So we've been encouraged by that, but we still need to get those testing numbers up. So it's at probably about 95,000 tests, and then the number of 10 and above were about 234.
The orange bar is the 10?
Test.
That's the number of tests.
Yes,
Yes,
no.
But it's only about 1,900, right? Is
No,
that-
It's
so
the
that-
number of children.
It
The
says
blue
the
bar are the number of tests.
Oh, I
greater
see.
than
I'm reading.
10.
I got to read over to the
It's-
left. I see. I see.
Yeah.
Okay, not the right.
Right.
Okay.
Yep, the number of 10 and aboves, the graph is over. The key is over to the right, and the orange bars, the key is over to the left. So,
Got it.
Yep.
Got it.
Next slide. Next slide.
And so
I'm
what
sorry.
was what was the actual hard number at 10 and above?
10 and above were 234.
How does that
Yep.
compare to the previous year?
Slightly lower. It's going down. The year before is a little over 300. So we did decrease significantly. But the test decreased also. So we want to,
Yeah.
once again, we want the test number to go up, but we want the actual elevated blood level to go down. So
Yeah, so Fred, what I'm looking at is kind of a equalizing proportionality of that. And then if you all could run that, right, based on the test differential. And then I would be very curious to know, like, if we still had a decrease, right? And if
Yep.
we did, what was that decrease? And then the other thing that I think is important is where did we see those decreases, right?
yeah.
So,
You mean based on like different years and?
well, I
blood
mean, there's a
levels?
proportionality that you have to do the analysis of
Right.
that, right? Because you have different numbers of tests that have taken.
Mhm.
And
right.
different populations too. So
Well,
that-
I'm not getting there. I'm just on the core numerical. If the previous year we did 109,000 tests and we had 300 children, and this year we did 101,000 tests, what I'm looking at is, given that 8,000 test differential, where do we really stand in a decline?
Sure. So how many 10 and aboves per testing?
Yeah.
Like, we'll find that
proportionally-
ratio.
Proportionally, what was that decline, right? But the second piece of that is, what was the concentration of where these 10 and above were? And then what was was there anything other, what was the predominant source in those concentrations, which we can get to?
I bet you there's going to be a next slide showing all that.
It It will not. It will not. Next slide.
Uh,
All right, so these are 5-9s, and the 5-9s did increase. We met with EPA, I think it was yesterday or day before yesterday, and we're seeing similar numbers across Region 3, so Pennsylvania, Virginia, DC, West Virginia. You sort of see that dip in 19, 20, and then you see it sort of come up in 21, 22. So it looks exactly the same across Region 3. So
Yeah.
we're talking as a group to see, you know, what we expect in the next year or so. We've already started talking about 23 and 24 data, and I'm trying to schedule a field trip to go to Delaware because they're going down to 3.5, I believe, next year. And so we want to talk to them about some of the things that they're doing and just sort of collaborate, because it seems to be sort of a regional trend, and to see if there's some things that we're doing that they're not doing and vice versa, to see if we can sort of get better together.
Yeah, I would urge you to talk to Allegheny County, out in Western Pennsylvania, right? But we are seeing that in other areas of the country, as well. And I don't know if it's just a rebounding coming out, people getting tested, or what the sourcing, of this is, but it is we need to move this number down. I didn't know if Cliff has insights on this that he would like to share, and I'm not trying to put you on the spot, Cliff.
we weren't doing well visits.
Oh, come on. You know you want to put me on the spot. Sorry. Let me mute my other meeting. So I'm sorry, Ruth Ann. What was the question?
Well, this trend of the slight, the increases.
Oh, yes. Yeah.
Right,
Yeah.
of 5 to 9s.
So, I've actually looked at that, and I have a lot of thoughts about that. It is similar to what we're seeing with other reportable conditions and surveillance conditions that we're seeing, and most of it is likely to be a result of deferred care related to COVID. And at least in my mind, it might, and by deferred care, I mean two things. The first is the general lack in 2021 and 22 of people doing testing means that people did not get, in many cases, a whole lot of routine medical care, including testing. And we saw that we've seen that with asthma, we've seen that with lead, and a bunch of other things. As a result, two things are happening at the same time. One is that we're seeing people come back for routine care and they're getting tested. And the second thing is, because they did not get tested and notified about low levels, in some cases, we are seeing people who might otherwise have been identified with lower levels who continue to be exposed. And then the third thing is people were sequestered in their homes for a longer period of time and had more opportunities for exposure. So those are my thoughts about those trends. So I think they're real.
Mhm.
Yep. Okay. Yeah, and we need to think about the strategy around that, like readjusting our outreach strategy around that, for sure, and how we can kind of look at that. So we'll come to that in a minute. 2021 it has been released, I believe, correct? The 2021.
Yep, it's been up online.
Is that your question, is the 2021 report, or what is your question, Adam?
No, Fred just sent back that it was 931 of kids with 5 to 9s and 22. I was wondering what the 21 number was for comparison.
I can get that in a second. Just give me a second.
It was more.
Thank you.
Yeah, it was a little less than 930.
Right. So one thing that I think we might look for in the 2022 and then 2023 number is whether or not we see an increase in testing, which I anticipate, and a decrease in the percentage of kids who have positive EBLs because we're testing more kids overall.
Right.
And, but whether we see an absolute increase in the number of kids with elevated EBLs, those are the key parameters that I think we ought to be looking at.
Got it. Okay, Fred.
Yeah, Wendy, I think I had one more slide, and that should have been the yeah, this is just the percentage of 5 to 9. So the encouraging thing is it's a little over 1.2% of the total population had elevated blood level from 5 to 9. This is an increase though, so we are concerned about this, and we, like Dr. Mitchell said, it's we're seeing sort of the trend of testing increasing, and so we expect the numbers are going to increase slightly, but we're going to try to find some interventions to have those testing numbers continue to go up, but also simultaneously have the number of elevated blood levels go down. So we're working on it. That was my last slide. Any additional questions?
No, just look forward to getting this out by hopefully the end of the month. And I think if I'm the department, right, I think you're going to have a good way to explain the increase in blood leads. I do have a question, unrelated. Hang on a minute, Barbara, go ahead.
And Fran, you and I had talked in the past. Sorry, you and I had talked in the past and gave me the one report about the levels greater than 20 and the breakdown. And I didn't know if that would eventually make it to at least this group, if not part of the report.
Yeah, and the question I have there is how do they relate year to year? Have the greater than 20s gone up?
In 2022, no, they went down. Yep. So they
Okay,
went
but-
down from 21 to 22.
I have concerns
I'll-
about what that's going to look like in 23, just given what we've seen come across our desk.
Mhm.
And so my Catherine, oh, thank you. We got you, I think, squared away there. The governor announced the Enough Act, and in his announcement of the Enough Act, he specifically mentioned lead. Will the Enough Act have impact on resources for lead or efforts around lead poisoning prevention or anything? And do you know, and if not, could you know by the next meeting?
Yes, I will certainly know by the next meeting. Nothing has been relayed to me.
Okay.
And so let me check in on that.
Yeah, in the public social media postings, there was mention during those remarks, and of course, that caught my attention to say, how do we build? And Cliff, I don't know if you know or others from state government know how the Enough Act may support efforts on primary prevention. Would love to know. And if there's efforts that we can do to support that, that would be great. Just a question.
I do not know is the simple answer with that.
Okay. All right, great. Okay, now work groups.
Barbara has her hand up.
Yes, I'm sorry, Barbara.
The very, very preliminary report, Fred, you did include 2023 in it, and there was an increase in the numbers above 20.
For 23.
For 23. This is a very preliminary report. Yeah. So there's higher numbers, and that's what we've been seeing in clinic as well. I mean,
I think this is the significant thing. It's when we talk about recalibrating strategies, recalibrating how we go after different resources. Of course, one goes to getting the state and some of the counties in the state to go after lead hazard control funds. So Prince George's County, Baltimore County, some of the eastern and western counties can also go and increase. And I know Theater's not on today. Maybe, I don't know if Jack is, but we have got to successfully go after those contracts. There's almost no reason not.
And who typically in the other states that you're seeing oversees that fund?
Well, it's Department of Housing and Community Development, and they did apply, and I'm not saying this for any reason to bash them, but they did apply and didn't get awarded, which is astonishing. We need to understand from the debrief why, and we need DHCD to let all of us help them get those funds. I think there ought to be a strategy to be talking with hospitals about, if they can do what other hospitals are doing around the country. Now, we have a crazy global cap that should incentivize some of this, but seems to work against it. But I think these are things that we need to collectively convene on because we need big pots of money. I'll talk about the thriving communities as an opportunity in a minute, but we should look at that. I'm going to run down these work groups and just see what we have, and we're going to have to change who's leading up at least one of them potentially, but maybe she'll volunteer to continue doing it. Susan, the MHIC, I know you said you and I spoke. Have you all had a chance to meet?
Actually, I spoke with Adam regarding talking to the Maryland Home Improvement Commission, and I think that the suggestion was on that to allow the legislative session to sort of come and wind down before we do anything there. I do think we had, and Adam certainly, pipe in at any time. We had met with the Maryland Home Improvement Commission probably maybe a year or two ago, with the same kind of concerns and the requests that were being made about trying to document training for the RRP. Of course, we're going to have resistance on that because a lot of the issues were a lot of contractors don't work in pre-1978 housing, and to require that kind of training or documentation for all contractors was a little bit met with some resistance on that.
Let me, if I can, I think it's not hard here. When you apply for an MHAC license, do you intend to work in pre-1978 housing, not just rental housing? Check a box, yes or no. If you check yes, you go over to a kiosk that will get you connected to or it can take you to a training. You register for a training and your license is provisional until you complete the training. You can still get the license and you have a period of time to get that training done. And if you don't get the training, the MHIC can say no to the licensure. I think that's just the simplest, easiest way to do this, right? But I know we have lots of thoughts on this, but that is something I hope the committee will look at. I can't imagine, I want to talk to the EPA about it too. We've got to get these things tied together in ways that get that done. Maryland is not an enforcement, that we did not take down the enforcement authority of the EPA. I know that in around 2012, legislatively, we were looking at doing that. Do you know what ever happened within the department on that?
Sure, no.
I would encourage you to talk to Horacio Tablata and get the history, because I think the state should also be able to do the enforcement provision of the EPA RRP and might be able to get federal funding support to do it. Susan?
Well, I think Paula, right, at the time had proposed regulations to change the definition of abatement to include renovation activities.
Right.
And in response to those proposed regulations, the Maryland Department of the Environment changed the definition of abatement in 2011 or 2012 to include the definition of abatement to also include renovation activities.
Mm-hmm.
However, there were no regulations that were passed to support the implementation of the change to that.
That's what I recall. Yeah.
Right. So that's kind of where we stand with that.
I know I met with Ben Grumbles when he took office, and at the time, and I will publicly say, Ben said he was going to get them out, and I don't think they ever saw the light of day. So I'm asking the department to dust those off, look at them and see what we can do. I mean, at this point, And I'd like you to look at them within the next week, because if there is any fast track legislative action that could be done while the legislature's still there, to just say that we could reopen them or not. But I would like an answer on that. Paul is shaking her head, I think.
Well, I can say, the department, we do go out on sites for any complaint, regardless of whether we have the ability to enforce the provisions of the regulations under the risk reduction and oversight and accreditation. And we do build a case and we refer it over to the EPA. So I do know that that's going on, because we get complaints a lot about unsafe work practices. So that does occur.
And nothing likely happens, or very rarely, when you refer it to the EPA.
Oh, I don't think that's true.
Well, I'd love to see the date on that, because sitting on the CHPAC, having just done the charge letter for lead, right, this was a concern. I strongly urge the state to revisit taking down you can move the enforcement authority to the state, but I think this needs to be looked at. We need to examine it, we need to know, and we need to have a cogent set of data on that.
I mean, we could certainly provide the data on the number of referrals we make to the EPA. Now, of course.
Well, the referrals, meaning result in actions or no actions, is what that's the data that matters, right? But let's move that to this committee and let's look at that if we can. Adam, I see your picture, but I don't see your hand up. Will you say something?
No, Susan hit the nail on the head.
Okay. All right. So thank you, Susan. Let us know when you're meeting next and what you need. Okay.
Well, if you don't mind, Ruth Ann, let me just go on another note. So what I did do, knowing that, agreeing with Adam that, okay, we can wait till the legislative session calms down. We can certainly pursue talks with the Maryland Home Improvement Commission. I did approach Jason Hessler, Deputy Commissioner of the Department of Housing and Community Development in the city of Baltimore, because several years ago, they had instituted a program where you can pull a permit online to do work in the city of Baltimore. And we had asked them if they could, upon the pulling of a permit, have documentation of RRP training. And at the time, with the newness of that permit database and program, he was hesitant to add any more kind of roadblocks to having people do it. However, in just probably the last couple of weeks, I did have a conversation with him. Wendy, I had sent over to you an attachment with a statement that is part of the permit pulling.
Yeah, do you want me to show that?
Yeah, if you could, that'd be great, because I think it's absolutely awesome. That even without having the Maryland Home Improvement Commission on board at this point in time, what Jason Hessler has included is what Wendy's going to show to us is this wording that is on anytime you pull a permit in the city of Baltimore, which I did not realize this, is that the city of Baltimore is an entity that requires permit to be pulled on so much more than any county. Now, this is the wording, and if you look at it, it does talk about the requirements of RRP, and it does require an acknowledgement by the person who's pulling the permit. Now, right now, this statement is at the top of the application to pull the permit. Jason said they are in the process of revising the permit process, and the wording is probably going to move from the top to the bottom, which I'm actually okay with, because I think that you always remember the last thing more so than you remember the first thing. But that has not yet occurred, and he did say that he would keep us posted on when those changes occurred so that we can be more aware of what actually is required and where that requirement falls in the permit process.
So, Susan, do you know if this is pending any approvals is it just approvals by the commissioner, or is it approvals by the city council, or do you know?
I do not know. I mean, I certainly can ask Jason, but he did not give me any kind of,
If you could inquire on that.
Sure. You mean in
Okay.
terms of the changing of where how the
Well,
permit process
yeah, yes, what's
proposed?
proposed, but what's holding up just doing it, right? And what is the timeline? And maybe, Wendy, we should invite Jason Hessler. Oh, look at this. Nicole Hart is there, and the hand is, there you go. All answers are going to come right now.
So we including Jason Shop, they are working on implementing a totally new permitting system. So they are working with the vendor to revamp the entire system. So there is a timeline on the launch, and I think there is going to be a period of testing. I believe it's going to be closer to the end of the year when the new site launches.
I think he did say that. Yeah. So my idea also, I'm not quite sure. I mean, we could go, I mean, that wording is, if nothing less, is, I think, wonderful wording. One idea that I had was to maybe perhaps we should be reaching out to the individual counties who, and that the struggle there is what county agencies have the responsibility for the pulling of permits is not consistent. Baltimore County Department of Housing, on the Eastern Shore in Dorchester County, I think it's Public Works. But we could certainly introduce that idea of having at least wording on the pulling of permits, not having contractors acknowledge the fact that if they're working in pre-78 housing, without it, maybe being a requirement from the Home Improvement Commission, certainly an acknowledgement at the time of pulling a permit. That's assuming people pull permits.
Got it. I think good work, and Nicole, just really amazingly great work by the city. So Jason continues to be great, as do you. Moving on, Chevelle, are you on the line?
I am. I'm here.
Chevelle, were you able to pull together a meeting on the lead testing kit public announcement work group?
It was a little challenging, but I did meet with Paula. I think it was last week. We did have a chance to meet to go over the lead testing kit public announcement. I had already started a draft and asked the rest of the team if they could review it and make additions to it and things like that. So Paula did say it did look pretty good, and she was going to share it with her lead expert on her team to look it over. Was it your expert, Paula?
Yeah. Well, that would be,
Chevelle, you sound,
it's funny.
I know you get a little.
So I have, basically there were just, it looked great. And Chevelle, I really want to thank you so much for putting that together. There were only 2 comments that I received from our lead experts within MDE. And one of them, which is what Chevelle and I discussed, was that, regardless of whether or not people use these test swabs or not, the new ones, that they don't meet the requirements for the Maryland law as far as exempting them from any provisions of using lead safe work practices or to meet any type of standard within the risk reduction law. So that's the only point of clarification that I think we want to make in that message. And I was going to, take that on myself to add that
And when do you
language.
think you're going to do this announcement, you think? During National Healthy Homes Month, which just got announced like 2 seconds ago?
We're kind of working on a little campaign right now,
Yeah,
and
yeah.
each month for whatever the National Recognition Month is, like for instance, Women's History Month right now. So we're doing a little social media campaign for that. And I plan on doing I think that's a really good idea to do that. I'm planning on doing during the the next month, several different aspects of each monthly campaign that are nationally recognized. So I have somebody really good working with me right now, and she's being really creative, and we're kind of brainstorming. So we're going to do a bunch of announcements throughout each month that'll feed on whatever the proposed national month is. So,
Well,
but it's going to pertain
Yeah,
to lead,
yeah.
obviously.
So I'm very sad to announce that Chevelle has decided to completely break my heart and move over
Aw.
to Baltimore Connect, a project that GHHI fully supports. And she did such a good job fully supporting that they came and convinced her to join their team. But it is a great move for Chevelle, who is going to be able to have a little more flexible time to spend with some of her grandkids and her family and get great things done and give out money in the Baltimore community. So I think just want to say super bad timing on National Healthy Homes Month. It got put quickly, but as Chevelle has done an extraordinarily great service on behalf of GHHI, will remain a part of our family. Hopefully we can convince you maybe to stay on this committee as a volunteer to help make sure it gets done. And I'm positive we'll be working together, but on behalf of everyone working on lead and asthma and healthy housing, I know Cliff probably agrees with this. Chevelle, thank you for your great service during challenging times of COVID and everything else. Nobody does a public booth better than Chevelle either. So she's upped our game on our look and our branding. So thank you so much, Chevelle. We appreciate you.
Thank you, Ruthann. Thanks.
We are looking for the next Chevelle Bash. So if people have good recommendations on that too, it'd be big shoes to fill, but we are doing that.
Chevelle, how long have you been with GHHI? Were you with the GHHI when they were the coalition?
Gosh, no.
No, but I worked with them when they was the coalition. I was
Oh,
partnering with them. Yeah, I've been with them for 4 years. I started
Yeah.
just before COVID.
Yeah.
Oh, did she? Really good.
Yeah.
Good.
It's all good stuff.
Mhm.
And Baltimore Connect is a really great program that is growing, has started in 2016 with support from a lot of good
Right.
folks, and now is in a position it's going to be giving out community grants and doing some good work there. So we'll make sure everybody, if you want to stay connected to Chevelle, we'll make sure we do that. Okay.
So I'll make sure I follow up with the commission about the PSA for the lead swab testing kit.
Fantastic.
Okay.
Alrighty. Moving down the hall, I think it has Angela Perry Hall's name on this for rental applications, the obstacles and application fees. But I know Adam and Barbara and Angela and Wes and I and Jacob met a day or two ago on this. Angela, are you on to maybe give an update? Are you?
Yes, I'm on.
Okay, great. Thank you.
So we met on yesterday, and we came up with some ideas on how we could possibly help the clients out with possibly waiving the application fees for the Healthy Choice voucher participants. And we're also going to work on a SharePoint with the homes that are lead-free, so that we could share, with the clients and, help them have access to places that would be suitable for them, because that has been a big challenge with them finding a place and then it not passing inspection, and then they have to wait almost a month before they get another inspection through. So we've been working on some things that will try and help them, and also the landlords as well, with trying to help them move forward.
And I want to just thank both Jacob and Adam for talking this through, and Barbara too. I mean, what brought this about was the discussion last commission meeting on the difficulty people are facing on the multitude of application fees that they just lose, right? One of the things that Angela brought up, and I think it was concerning to myself, to Adam and others on the call, was these fees that are now, we have at least one case we know, but I think we're hearing of others. People are getting charged just to go see the unit before an application is even accepted. I think that's probably illegal. We're going to be looking at
Who
that.
is doing, I'm sorry, who is?
You want to say a little bit more about that,
Who is
Angela?
imposing the fee?
Yes, so so it's been brought to my attention that some of the clients that are going to look at these units, some of the landlords are asking them to put down $100 to hold the house or pay a fee before they can even see it, and then they have to pay application fee, and if they have another child, older child, that they'll have to do a background check, then that's another $40. So, you know, some of them have been paying these fees, and, you know, they don't have money like that to give to these landlords, which I think some of them are scams, because, you know, that's not acceptable. Just not.
Yeah. So we're going to be talking to the legal services community about this, and I'm going to try to make sure that we get the tenant advocacy groups together to discuss the same things we were talking about, just to make sure we come up with solutions and also share. So what we are doing here is the resurrection of the old lead-safe housing registry, which had fallen off the shelf entirely. So Nicole and Catherine from the city, one of the things that we used to do, was to get the units from the lead hazard control program, and then ask the owners if we could also list their units if they were up for rental, any of those coming up that may have been through your program. So we'll talk offline about that as well. But I think we're getting back to the former goal, which I don't know if it's still a goal in the HUD grants, that every community have a lead safe housing registry. Once we get this up, we thought about, we're going to launch it first through SharePoint, just to allow the owners to take units up and down from that and share that with home visiting programs and others. But eventually we'd like to get it up as a published list on websites that we will just keep updated, that could be refreshed. It really was a very, very good tool many years ago. And I think we're going to,
I think we were part of that as well.
yeah, you were.
So, and now that we have this interface where we can look at certification.
That's right. And
You
then,
know.
and maybe that's the path through too, is
Yeah,
to run
right.
all of those addresses through. We have to do them by law individually, I know,
Right.
but we'll just do that. You can confirm they have active certificates. And I think that stays within that. But I really appreciate, thank you, Angela. Any questions for this group? You dodged a bullet. You are not Fred Banks today. Thank you. So I'm just going to give folks, I did mention this last meeting. I just want to remind folks of this. But GHHI was awarded a $50 million contract by the EPA.
Oh, congratulations.
To give away what will affect, to provide technical assistance through a myriad of parties. So it's not just us, throughout Region 3, the EPA Region 3, which is Pennsylvania, Delaware, West Virginia, Virginia, and the District of Columbia. If I missed anybody, I apologize. We will give out in Maryland about $3.5 million a year for 2 years, and maybe a little bit on the third year. And these grants will range from $75,000, $250,000, $350,000 to go to groups not only working on lead, but lead remediation is part of this. But it could be, stormwater issues. It could be environment issues related to the bay, and a long list of that. But in it specifically is lead. It is for nonprofit groups. It is intended to build capacity. So if there are small organizations looking to do education, hazard control, or other things, we are looking to build their capacity in this work. could go to folks who are focused on childcare. It could go to folks who are working on contractor development work. And if there are nonprofit property ownerships, I imagine that they would qualify. I'd have to look at that for sure, but I think there will be certainly supports on building a lot of this work, also around home visiting health. Those things that touch environmental justice, equity, and other aspects. We will be providing the first grants come summer. So please be looking for that. We will have a large tranche of money out that we will want to have under contract by July is our goal. And so this is going to move pretty quickly. The other thing that we are going to do is work with philanthropy and other sectors where we can to match fund this money. So I think all of us who work on the federal dollars coming down know in so many ways there is going to be a lot of capacity needs that need to get built in order to handle the money, in order to get it out, right? So we're looking at this strategically. We're looking at it strategically around many things. And as I've raised before, as $12 billion come down just for just 40 low income, historically disinvested communities around the country, and a lot of that in Maryland. As I've said, I think the Department of Health, Department of Housing, MEA, MDE, and others need to be thoughtfully prepared about the amount of lead dust that we will kick up in this process of pulling out, going fuel switching from steam, oil, and gas over to electric, how we will have to do a lot of repairs as we put in upgraded electrical systems, upgraded roofing to hold solar. There's a lot of opportunity one way or the other. One, the unintended consequence to bring more hazards to bear in exposure. But we're trying to turn that opportunity to the number of houses that we can do investments in. How do we do the cleanup, right? And there's going to be really good need for education. The other thing, not directly related here, but GHHI is going to be working very hard to make sure that every family who gets touched by a housing program related to greenhouse gas emission dollars or electrification dollars, we're hoping to get all of those houses over to a whole house approach that will include health and safety, but also to drive the rebates, the tax credits to lower the cost, and where we can get every family enrolled in the earned income tax credit, which is very underutilized in Maryland, but very much in keeping with the administration's goal of leaving no one behind, of building wealth for low wealth families. We want to work with that. We've had brief discussions with the comptroller's office about how do we maybe weave these together. But I will say we have to be thinking strategically about the disturbance of lead-based paint. We have to be thinking about how do we get aligned resources here. And, you know, for Fred, you're looking at numbers there, and you're looking at lots of opportunities of how do we move those numbers down. My concern is the 23 uptick we've seen. We have a challenge coming here. It's going to take a lot of tenant counseling. It's going to take a lot of contractor counseling. It's going to take a lot of community education. So I do want us separate and apart from thriving communities, which we're going to operate within GHHI, but almost as an independent entity. We will be getting information out on that. But I do want to compel this group and others who care about lead to start to get together an effort to build a lead fund, a lead and healthy housing fund, and to do that like other places around the country have done it. I think the one thing we see often around the country is people want to be like Maryland on lead, but it's made us complacent about what we need to support the low wealth property owner who's struggling to keep their units up, the low income homeowner who has lead hazards and their grandchildren are present and they're trying to do that. We want to be as supportive as we can to the Catherine Taylors and the Nicole Harts and everybody else who's doing this work, right? And the work that Cliff is doing with DHCD, but there are gaps in that. There are good owners who want to do good things. We need to support them. I think putting together a kind of a private sector, public sector look at how do we build this fund, I think would be super important. I would appreciate if you would raise that with the secretary, because in other states, it has had the involvement of state cabinet and mayor's offices and others in that effort. And we would like to convene that by this summer to be thinking about how do we match fund a lot of this other work that Thriving Communities isn't going to be like lead is not going to be the predominant thing, right? There's going to be a lot of people coming in for lots of issues under the broad qualifications there. So we'll be doing a launch of this. We're doing a lot of public training about who's on the advisory board. Advisory board will be a lot of the decision-making on the applications as they come in. We've got a really good independent way that we will rubric that. But also to be aware that if you know of organizations that we want to lift up, we can help strengthen that are going to help us advance lead poisoning prevention and healthier kids. Let's make sure that they do that. So we'll say more about it. The last thing I did want to raise before we get into reports here is HUD, in their wisdom, I don't think with much consult to Paula or Cliff, just declared that April is National Healthy Homes Month. It used to be June. Our team is going to be putting together a lot of social media work around that. I don't know how quickly we can put big events together, especially that we're going to have a transition in our outreach side. But we will be pushing out social media toolkits. If there are opportunities to do something together in work to raise awareness during the month, we will do that. So be easy on MD and others who are getting this late news as well. But I think we will try to pull as much as we can together to use the awareness month. A lot of people will be out for the National Lead and Healthy Homes Conference that HUD is doing in Minneapolis or with the Building Performance Association. But I think I know as an organization, we're still going to do a lot of outreach in June, and then we'll do more outreach. And I think, again, would like to ask this commission to work together that our October meeting would be a public lead summit, much like Rhode Island did. And I think Chris and Fred, who were there, can tell you that was a really worthwhile thing. And I think it'd be timely. Dr. Mitchell, he's just gonna do this awareness month all on his own.
Yeah, so I guess, Madam Chair, we should be grateful that they didn't make it March.
Yeah, I mean, right, or February and tell us after the fact.
Or February, and we could have
Right.
retroactively done
Yeah,
that.
now we love our HUD partners. I'm not sure the basis of the move, but they made it and we're gonna support it.
Yeah. So we'll clearly work with you as much as we can, recognizing that we already have April is for other reasons an insane
Right.
month anyway. Not the least of which is it's still during legislative session, and it tends to be a very busy time in the first couple of weeks.
In many states across the country, right? Is it also when is National Public Health Week or month? When is that? Or did
April.
April, yeah.
Yeah, okay. There you go. Well, maybe we can,
Yeah. It follows women's national history.
and it is
Yeah.
Yeah, it is Women's Natural History Month. So a shout out to all of our women on this call who serve on the commission, who work at all of our departments. You know, way to go, Barbies. Let's go. Shouldn't have gotten at least one award, right? Did they get an award? They got good song, I think Barbie did, right? But no, seriously, really amazing leaders, right? That we need to lift up. Not to mention the Department of Health, Laura Herrera Scott, our secretary, the Department of the Environment, Serena McElwain, who I hope I am saying that properly.
McElwain.
Among many others. You know, but I think there are everyday heroes in this work here. So really appreciate all that we do there. Cliff, did you have other things to say about National Healthy Homes Month?
No, I'm wrapping my head around the change in timing, and I
Yeah.
have nothing useful to contribute as usual.
Yeah, so I'm gonna try to see what I'm gonna work with our comms team, see what we're gonna push out. It may be that we're pushing out a lot of the different messages. And if you're releasing a report soon, right? I can urge us to think strategically about where we're seeing these upswing in cases, and what that really comes about. So Fred, I'll be interested what the EPA and what you gathered from your trip to Delaware as well, on that, because I think we got to have a changing strategy for the new world that we are in. All right. I don't know that we don't really have an active legislative subcommittee. I think you've given us the update on the fees. GHHI was happy to testify in support of that.
I have an update for the Enough Act.
Okay.
Yep. So our legislative folks reached out to the governor's office, who said that a community would be able to utilize those funds for lead remediation or abatement if the project was within the Enough Act jurisdiction and they chose to use the funds for that purpose.
Great. And is that something before the legislature right now? And are there hearings on the Enough Act? I guess they've already had the hearings, right?
They've already had the hearing. I am not sure if it was cross-filed, so there may be another hearing.
Okay. I actually think they've had both. Thank
Had both already.
whoever, if that's Brad or Safe or whoever it was.
Miles.
Miles, I don't know Miles. Okay, thank you for that. So there is another potential resource opportunity there, which is just great, right? Okay, so Adam or Anna, do you have anything else you want to add on legislation that I know we're not really, there's no major lead legislation, but any other updates, Adam, especially on tenants' rights or property owner issues that might impact us?
I have nothing right now. I mean, there's an ungodly amount going on, but I've got nothing for the group right now.
Okay. Anna, anything?
I don't have anything for the group either. Thank you.
Okay. And Wes, if you're on, is there anything of note you think that should be brought up?
The baby food bills, House Bill 97, SB 723, that has not moved at all in committee. That was to ban lead and other toxic metals in baby food. So there's no movement on that. The first hearing on lead and hunting ammunition was held last week in the House. So that obviously there's nothing active there, but I'm sorry, in the Senate hearing was held last week on lead and ammunition to phase out lead and ammunition. One note on that is the House version of the bill has been in the Rules Committee for over 3 weeks, so that may give an indication of how the prospects are for that bill. It hasn't even made out of rules in 3 weeks, so there's obviously opposition to that bill on lead, and that was actually related to hunting, so ammunition for hunting and lead, and those are the major lead bills. We talked before also about the Maryland Capital Bond Bill Act, which has funding for special loans programs, and that has not been scheduled but is under negotiation, I'm sure, in terms of what that will result in for special loans for DHCD. So I don't know if Jack has any updates or anyone had any updates on that funding.
Yeah, I don't know if Jack is on. Is he, Wendy? Or Jack, are you there?
No, he's not on.
Okay, we'll get an update and we'll send an update on those. I will say I was recently interviewed around lead in firing ranges. And really significant data that I think caught me even by surprise, about 600 active firing ranges that have not been cleaned up for lead dust and other matters. And then the interviewer was from New Jersey, where they're reusing the building for food that is being transported under like movable feast and Meals on Wheels are in where the firing range used to be, and there's active high lead contamination in the dirt and sand that's on the floor of this building. Something we should pay attention to on the cleanup of those sites. I think the lead and ammunition for hunting has been driven by a lot of the data coming out on eagles and others that are getting poisoned at a rapid rate. And by the way, we had a American bald eagle in Patterson Park recently. So hopefully without this exposure, we will track the baby food bills. Cliff, do you know anything about these baby food bills that are in front of the legislature?
I do know about the baby food bills.
Okay.
What's the question though?
What are they aiming? They're just aiming to say the state would control the
Yeah, so it's kind of complicated because they basically are requiring the companies to do heavy metals testing and then label and put the information on the labels. There have been amendments suggested that would because an early version had the department involved in this. It gets very complicated because it's interstate commerce, and this is generally speaking something that the FDA does. But at least some of the amendments that I've seen would, in fact, allow any consumer who believed that there had been an exceedance or a problem with a food based on the label to submit it to the department. And then the department would have the authority to go back to the manufacturer. It's not exactly how this would be administered or how it would work.
Okay. Well, we will do a little more research and we'll circulate what we know and copies of the bills to Wendy and if need be, so that people have access on the commission to these things. Let me move if I can. If you don't have other things to add from previous presentations for your department, you are free to pass, but Tyler for MDE.
Sure. You heard a lot of my stuff, just to be an effect.
Yeah, that was quick. That was good work.
Thank you. Thank you. And in regards to, I know you have questions about the RFP, and that is with our attorneys currently. And so trying to push them along, and we'll hopefully have that review done soon.
Yeah, this is for funding made available by the Maryland legislature last year for tenant counseling, legal services, and outreach.
Yes.
Okay. And you have no time frame on that?
I don't have a time frame right now because then it goes to OSP and they are a wild card.
Okay. What does OSP stand for?
The Office of State Procurement.
Okay, gotcha.
Yeah.
There you go. We learned something new today. MDH.
Couple of things. One is the FDA yesterday and the day before expanded its concerns about the lead in applesauce to lead in cinnamon, not necessarily associated with applesauce. So there's now a release, a shout out to the Maryland Laboratories Administration and Dr. Sin Urban, because the FDA cited a number of products that have been identified that exceeded the FDA's limits for lead in applesauce, in cinnamon. And that list of products included products that were purchased in Maryland. So that list is on the FDA website. If I can use my phone, I'll try to find the
Yeah,
link.
if you would do that, right? And
Yep.
so Cliff, not to put you on the spot, but should consumers in general stop putting cinnamon on their morning cereal or wherever they put it?
So this is a question that if you look for the source, these are some sources that came from some distinct areas. And in general, I would say all US based manufacturers are being urged by the CDC to redouble their efforts to do quality control on their products to ensure that there is no lead in them. And I'm sure that all such firms, including those based here in Maryland, are in fact, especially with this latest FDA announcement, going to spend a huge amount of time looking carefully at their source material and products. So I would say you should be confident, especially if you are now if you're now purchasing new materials, that's been screened. And I'll in just a minute, I'll put the FDA announcement link into the chat.
Yeah, and Wendy, if you would just then copy and share that to all of the.
I have it.
Okay.
I'll
Wendy.
share it with everybody, Cliff. You don't need to worry about it.
Okay, that's great.
Oh, thank you, Paula. Once
You're
again,
welcome, buddy.
you've saved my bacon and cinnamon, which is a great
There you go.
combination.
You shouldn't eat bacon or and we'll wait on cinnamon. All right, Paul Rogers.
Yeah,
Thank
I just wanted to follow up a little bit on what Cliff was saying. The New York Times had a big article about the FDA, and they're supposed to do 19,000 inspections a year of international products. They did 1,200. So I'm really disappointed we didn't get a chance to hear from them today. So hopefully next meeting we'll get a chance to hear.
That may be why, right? They're now busy doing inspections.
It could be.
Or
I
they
look
don't want to
forward
answer
that.
the question.
Lots of questions for them.
Yeah, let's get it into the upcoming presidential debate, I guess. Anyhow, go ahead. Yeah, not touching that.
No,
Go ahead.
I was just going to add to what Paul said. It's particularly when you are dealing with intentional tampering, even with the FDA inspection regime, it's really, really difficult at the source to control that. So it really does depend on manufacturers doing a constant review of their source materials, and that's where probably our greatest strength is.
So are there kits like I can test my water and test my soil and my paint and send it off? Maybe
No.
we should start a company that
Yeah.
does food testing. I don't know.
No, this
probably
is
standards
very tough testing. It requires very sophisticated instrumentation. You can't really do it at home. And we are fortunate in having a lab that is one of the foremost labs in the country at being able to do this. But this is what the whole food inspection system is there for.
Yep, absolutely. Well, I'm glad, thank the lab people
Yep.
here. Mangela. Thank you, Jacob. Mangela.
Yes, ma'am. I met with Mr. Banks and his team from MDE to clarify the childcare COMOD language in reference to new applications that are, whether it's the owner occupied or rental property for childcare operation. And we are making some changes to our application. And that meeting was very productive and useful. Thank you.
Thank you, Angela. just make sure, Mangela, this is Paula, when you're completed your application, like Fred and I discussed with you, just make sure, if you could, not make sure, share it with us so we can just make sure that that language is clarified for you all, so there's no ambiguity in your, for your applicants.
Yeah, we are just going to insert the language that is there in the COMART, so that there is no further explanation, clarification required from the participants. Thank you, but I will share the application once we make the change.
Yes, right. It would be good, just so, you know, because it is there are complicated nuances to COMAR, and we want to make sure that your applicants, you know, are, provided good education on that.
Yep, absolutely. Thank you, Mangela, for being a totally unsung hero.
Yeah.
Right, appreciate you.
Thank you.
Benita?
Benita is not here today.
Okay.
And
I'm
Theo
gonna-
is not here.
I'm going to flip this around and start with Julie from the Baltimore City Health Department, if she's there, just saying if there's anything Julie needs and support or has to report, or is she here today?
Good morning. Yes, I am here today. Just a quick report and proud moment. My team tested 59 kids the other day at one of our testing sites. It was with St. Vincent de Paul's Head Start program. So very excited about that. And we are continuing to do some more testing throughout the spring.
Well, that's great. And Julie, when you are doing testing, are you getting information over to families also about how they can apply to the city or others for lead hazard control?
Yes. Yep.
Okay, great. And if they have more beyond lead that they need, please feel free to refer them to GHHI for a whole house piece, but do that in partnership with Catherine. Really appreciate you doing that and the great work. How is the job going for you?
It's going really well. Yeah, thank you.
We're glad you're there. All right, Nicole and Catherine. Towers of Power.
I don't have anything. I will let Catherine report if she has some updates.
Hi, everybody. We do not have any updates other than one of our grants are in the process of closing. We do have our 2019 grant still available, so we are still taking applications at this moment.
Fantastic. That is great. Thank you, Catherine, for the partnership. I don't think we have anything more to report from GHHI, but Wes, Chevelle, Angela, anything there? All right.
Yep.
All right, well, check our LinkedIn page. GHHI is going to be hiring 20 new people between now and June, it looks like. So there are lots of great things regarding positions that we'll be putting into the Thriving Communities Fund and our other work. And as noted, we also are going to have a new director of outreach. We appreciate everybody's support and providing good talent recommendations. A lot of fun to do some important mission work. If there are any comments from the public. Barring none, Wendy, let's get a motion to close the meeting.
A motion.
Second,
Second.
all in favor?
Aye.
All right.
Aye.
Go Tar Heels.
Opposed.
Go Tar Heels, beat Duke. All right, thank you.
Thank you all.